The decade of the 1930s marked the development of hospital staffing by registered nurses. Prior to this time, most nurse graduates had been entrepreneurs, self-employed, and private duty placements. During the Great Depression, though, nurse practice moved to an institutional model, which graduate nurses became employed by hospitals rather than private patients. Thus, poorly paid graduate nurses gradually replaced students in the care of hospitalized patients. Because nursing care now became part of the hospital's patient expenses for room and board, nursing care, the central service provided by the hospital failed to be identified as either an expense or a source of revenue. In response to these conditions, the convention I mentioned previously in 1946 was held for an improvement in work hours, salaries, and luckily that was eventually achieved. The increased need for nursing care was linked to a variety of social factors, which included the growth and continuous urbanization of the population, the increase in number of women who married before the age of 20, the increased availability of hospitals and health insurance plans, as well as the advancements in medical treatments. From the post-war years to the present, the nursing shortage has increasingly been referred to in terms of supply and demand. As I mentioned before, this is a shortage that occurs because the supply does not keep up with the demand, hence supply and demand. During the post-war period, members of the public sometimes blamed the nursing shortage on the nursing profession for its failure to provide an adequate supply of new nursing recruitments and education of students. And to response to this, Illinois State Nurse Association joined forces with the Illinois League for Nursing Education, the Illinois Hospital Association, the Illinois Medical Society, the Blue Cross, to sponsor Student Nurses Week. Messages were given in support of nursing education and nursing as a career. It was broadcasted through the radio, sermons in churches. It was just very put out there because it was such a big need for the society at that time. In a study of nursing shortages between 1932 and 1952, a researcher named Spahn actually discovered that although the number of hospital beds in the U.S. had increased by 52% and the daily patient census had increased at the same rate, these increases alone were not responsible for the shortages of the area. He realized upon closer examination that because the average length of a patient's hospital stay had decreased significantly over the 20-year period, more patients were cared for annually, but their shorter hospitalizations did not increase the average number of patients who received hospital care at all on a given day. So hospitals continued to deal with nurse shortages into the early 1960s, when the federal government actually intervened by once again providing subsidies for nurse education. In 1964, President Lyndon Johnson signed into law Title VIII of the Public Health Service Act. This legislation became known as the Nurse Training Act. The legislation was built upon an earlier report from the Surgeon General. The report, titled Toward Quality in Nursing, called for tripling the number of nurse graduates in each succeeding year, a fourfold increase in the number of graduates from the baccalaureate programs in nursing, and a tenfold increase in nurses with master's degrees by the year 1970. While recent projections indicate growth in the nurse workforce through 2030 will be large enough to replace more than 1 million RNs who will retire over this period. Because of the growth of the RN workforce will be uneven throughout the country, temporary and local shortages versus national shortages are still expected throughout the next 10 plus years. Over the past 15 years, the registered nurse workforce was challenged by a nursing shortage that exceeded 100,000 RNs, 2 economic recessions, and implementation of health reforms beginning in 2010.